Good afternoon. My name is Corina Herrera Loera, and I'm a public information officer with the Emergency Operations Center here for the County of Santa Clara. Today we have a special community forum where we're going to have a guest from the Santa Clara County Office of Education. And before that, I'm going to review some important information here in our county. Gloria, if you can help us with the screen. Thank you so much. So the first information that I want to share, as I do biweekly, is our daily update. And so 87% of our 12 and older community members with that have had at least one vaccine dose. And then 81.5% completed the vaccination. So whether it's one of the Pfizer or both of the Moderna. And our new cases, 7-day rolling average is 341. Here, we're breaking down the vaccines according to race, ethnicity, and you can look up the specific ethnicity if you're interested in knowing the rate on each one. Here, I do want to highlight that our Hispanic Latino community continues to be on the lower end. And so here you can see that we're 68.8% of those that have been vaccinated. And so we still have a lot of work to do, especially those of us who work in and live in the East Side community. We know that the rates continue to be higher, and we need to continue to get vaccinated if you're not and you are in that area and or that community. Yes, we suggest that you get vaccinated. Next slide, please. And on this one, this is a new slide that I'm introducing now. It's on our dashboard, so you're welcome to go back and look at that on a daily basis. And so this is our Santa Clara County COVID-19 case rates by vaccination status. So, some ask, why is it important to, get my vaccine? Or, I might as well not, I waited this long, or whatever the reason is. Here is a breakdown of those rates, the current COVID-19 rates by the vaccination status. So if you see on the orange, those rates, those COVID-19 cases are those that had not been vaccinated. So the rates are higher if you're unvaccinated. And the rates over on the light blue on the bottom are those that were fully vaccinated. And so it's only 10.6% compared to 58.6% of those cases with COVID-19. So for me, it's important to highlight the importance of being vaccinated. Next slide, please. And this, is just showing that extra protection helps. So this is a model that our office created to kind of show that importance of, people say, well, why do I have to do all these things? Wearing a mask and, have my vaccination. Can I just do one? This is important. So especially children in school, right? We have them wearing masks, those that are able to get vaccinated, the teachers, because it adds layers to reduce the opportunity for the virus to break through. So this is a visual for those of us to just remember, that's right. Okay, let me remember to wear my face mask. Let me remember to get vaccinated. Let me remember to stay socially distanced. The importance of all of those layers so that it reduces that opportunity for that virus to break through. Next. And so just a reminder, let's get our kids vaccinated for their protection. Those of us that have children 12 and older, and those of us that have younger children, we understand that hopefully sooner than later, the opportunity to get them vaccinated may come up. In the fall is what we're hearing. We don't have a definite date, but as soon as those dates come up, that we are able to vaccinate them. And so 3 reasons to vaccinate our kids for school. It protects them from COVID-19 disease, as I mentioned and went over. Next slide, please. And then unvaccinated students who have to quarantine will miss out on sports. So again, it lessens, the ability to get COVID, because we know that if they do have COVID, then they do have to stay home and quarantine. And not just do they miss out on sports, which is highlighted here, but also from school. And then the third reason a routine testing is not needed for kids who are fully vaccinated. So I know a lot of students, my daughter just really disliked getting tested. So it's another reason for her. She was like, I'll just get the vaccine. I don't want to go through that test. And, and so that's another reason amongst so many others. Next slide, please. And so these are the vaccination sites this week that we have. I know it's really small. You're able to, rewind and come back and take a screenshot and highlight. But if you're not able to do that, make sure to go to our Santa Clara County dashboard, and there you will be able to view the list and find a place that's closest to you that will be able to provide the vaccination, as well as we also have the list of testing sites near you. Next slide, please. And so we did receive some questions around the air, around filters. We do have our guest who's going to touch on that. But I did want to highlight, especially because we do represent the public health department here, I do want to highlight this specific site where you can go there and you can put in your city. I put in San Jose. So this is a map that it gave me for today. And we'll break down the air quality in our area. So you are more than welcome to, use that site and figure out what the air quality is in your city. And like I mentioned, David will be talking about, thank you for those of you who submitted questions. He'll be explaining a little bit and responding to one of the questions that came in regards to the air. But I thought this was important to share with our community. Next slide, please. And so I know some of you already know we have a third dose, but as of right now here in Santa Clara County, the additional COVID-19 dose is only available for people who are immunocompromised. So this is a list of, what the conditions include. Make sure that if you are on this list, that you go and receive your third dose. We are in the process of looking to see what that next phase is going to look like and being able to provide the third dose to our entire community. We will make sure to let you all know and make sure to promote that information on our Facebooks, on our public health department pages, on our dashboards. So just stay tuned. We will be opening up that phase in the near future, but for now it's only open to those, the third dose is only open to those who are immunocompromised at this time. Next slide, please. And so I want to highlight that tomorrow we have an event with the county, and this is for the emergency rental assistance. So if you're a qualifying renter impacted by COVID-19 or landlords, you're eligible for emergency rental assistance. And how do you know if you qualify? If you see here on the flyer, if your household size is 1, the income limit needs to be 82,450, 2, 94,200, 3, 106,000, and 4, 117,750, and it goes up. And so you're able to see the information there. If you do qualify and you're interested, you can show up tomorrow between 10:30 a.m. and 3 p.m. at our Family Justice Center courthouse. And it's on the 8th floor of our judicial conference room. And if you have any questions, if maybe you forgot to write down the address, feel free to call 975-4444 or email evictionhelp@sanjoseca.gov. And so this is a partnership between the city of San Jose, you can see there, and our county to ensure that we're assisting our community in the needs. Next slide, please. And for those of you who have small businesses and, there's a need, there are the small business grant programs, and the deadline to apply to that is September 7th. So it is coming up. If you do have a small business and you qualify for this, make sure to apply. Again, the deadline to apply is September 7th. So you can, again, go back and get the information off of this flyer or go into any one of our Facebook pages and get the information from there, or call 211 and we will be happy to assist you there as well. Next slide, please. And as I always do, just ensuring that we put resources for everybody. As you all know, this community forum is to inform you all um, of what we have here in our county related to COVID-19. And it's impossible to cover everything in 1 hour, but I do my best to ensure that I highlight the most important information. Here you'll see a list of the different resources. Um, and I know it's small font, but if any number that you remember on here is a 211, you can always call there for any of your needs and you will be guided to the appropriate office, whether it's rental assistance, whether it's testing, whether it's vaccines. Somebody will be there to help you in your language. Next slide, please. Great. And with that, I'm going to invite our guest speaker, David Putney. David Putney is with our Santa Clara County Office of Education, and he has graciously accepted our invitation to come and give us an update in our schools here in our county, any important information as parents that we should know, and answer any questions that you might have in relation to schools. I do see our community has been active on this forum already. I saw a lot of comments coming in. I'll take my time to read through them, ensure that you are asking questions regarding this event today, because I know that in the past we've unfortunately not been able to get through them all. So I'm going to make sure that we go through all the questions related to schools and any information I might have presented. And I appreciate everybody's comments and posts. Keep them coming. We're here, we're the county, and we want to ensure that you all get the information, the actual information, and not, go by the myths that are getting posted, that unfortunately some of us, and our community members might believe. So we want to make sure that we bring factual information to you, and the most accurate, and be able to answer any questions you might have, especially to dismiss some of those myths out there. So anyhow, welcome, David. And do you have an update for us in regards to
Great.
schools?
Yeah, wonderful. Thank you for having me back. Always glad to show up here and share some information. The schools update, California Department of Public Health updated the guidance the end of July, and then they updated it again August 2nd with some clarifying information. I would imagine the majority of our viewers already have this information. If you'd like to see the full document, it's available on the CDPH's website. It's easily available if you go to their cdph.ca.gov website, and up there you can search for new updates, and it's fairly easy to find under schools and updated information. I'm not sure, Karina, if we have a way to post that, or we could put that in maybe future posts, just an active link to it. But the overall is basically that the school guidance has been broken into 15 mitigated areas, specific areas. And so if we think back to the Swiss cheese picture that Karina showed us, where it's the layers of mitigation, all these layered interventions help allow schools to be as safe as possible with COVID-19. So the 15 areas are masking, physical distancing, ventilation, recommendations for staying home when you're sick, screening and testing, case reporting, quarantining recommendations for vaccinated individuals, and then also quarantine recommendations for unvaccinated, isolation recommendations, hand hygiene recommendations, cleaning, food safety, vaccination, and also safety planning and transparency. Those would be all these different layers, and kind of that sliced cheese picture would put together the protocols that the California Department of Public Health has put together. I'm not going to go over all 15, but I will mention the ones that are probably the biggest areas that people are most concerned or interested about, which would be the quarantine. Unvaccinated and vaccinated individuals in schools have slightly different protocols for the students. Fully vaccinated individuals, if they're exposed on campus, students specifically, have the safety of the vaccine, which allows them to continue to stay in school. Masks are expected to be worn indoors in all schools in the state of California. many schools in Santa Clara County and across the state also expect students to wear masks outside. So you'd want to check with your local school district to see, does your school district expect outdoor masks? And if so, and if they choose to do that, that's allowable. And that would be yet another layer of protection that that school district is using to keep their students safe. So a vaccinated individual that is exposed to COVID-19 is identified as a close contact, would be allowed to stay in school and would be expected to test 5 days after that exposure. And if they are symptomatic free, no symptoms, also known as asymptomatic, no symptoms, they are allowed to stay in school. And then the results after the 5th day test, in the event that they are positive, then they would go into an isolation. If they're negative, they would continue on through their regular activity. Vaccinated individual students are allowed to also participate in extracurricular activities such as athletics or performing arts, or maybe their outside commitments outside maybe work or other things. That's the benefit of being vaccinated. One, it protects you from getting COVID-19. It decreases the likelihood of having a negative, really bad case of COVID. And it also allows you to continue in school while you await your test results. Unvaccinated students, if they are identified as a close contact, the school needs to ensure that they've been wearing their mask. And if they've been wearing their mask, the student is allowed to stay in school and test immediately. And then while they're waiting their results, they're allowed to continue to come to school wearing a mask and then test again on the day 5. When they get the results back from the immediate test and after day 5, if it's negative, they can continue to be on what we call a modified quarantine. They can continue to come to school regularly. The masking is protecting them. It's also protecting the other students in the event that they become positive, and they can continue through that cycle of testing. Again,
David, can I interrupt you real quick? I am seeing here through the comments, I'm trying to get through them all, that I think the volume might be too low. If you can increase the volume,
Okay, is that better?
I'm hoping.
Hoping. Is that better? Better? Let's see.
And I can hear you fine, but
Okay.
the community mentioned that it was low. So
Okay.
if
Well,
you
let
put
me
it up, hopefully it's better.
maybe I'll try to take my headphones off. We had echo before, and
Yeah,
maybe
let's
that was
try
part
that.
of it. Okay. Okay, is that a better volume, I hope?
Let's
Too
let's
quiet?
let's do it. I think.
Okay, I'll try to talk louder. I apologize. I'll use my teacher voice. Modified quarantine is for students that are wearing a mask in class consistently. Those students, if they're unvaccinated and they're wearing their mask, they are eligible for a modified quarantine. The modified quarantine allows students to stay in school, continue to stay in school, but they need to test immediately as well as day 5 after the exposure. When the test results come back, if they're negative, that's good news. They can continue in their modified quarantine. The modified quarantine is a period of time that they're testing, and after day 7, if their test results have both been negative, then they are out of their modified quarantine and they can go back to regular activities. When they're on a modified quarantine, they're not eligible to do after school activities such as athletics or performing arts or different activities. Only modified quarantine allows them to stay in school. Is that volume better? Yes? Okay, good. So the modified quarantine is probably the hardest one for families and students to understand. But it really helps kids stay in school. The mask is really helping people stay safe. Let's see, a few other updates. We had questions come in about air quality and schools. We've done some research. There's been a local webinar here in Santa Clara County at the County Office of Education around air quality. And with the air quality recommendations that schools have updated their HVAC systems, their heating and cooling systems. And when the air quality gets higher, from the normal range 50 to 100, it's pretty good air quality. That's sufficient for doors to be open, activities to be normalized. When the air quality gets above 100 to 150, it's recommended that individuals would stay indoors and that they would then rely on their HVAC systems to circulate the air and to filter out the air. The systems, even above 150 up into the 200, the 250 range, the air quality, the HVAC systems are very effective at removing the air smoke particles and are also effective of removing COVID-19 as long as they are a MERV 13 rated filter. So the schools in Santa Clara County have participated. I'm not sure, specifically which school districts where they are, but the majority, I would imagine almost all the school districts have worked on updating their ventilation system, improving their filtration system to MERV 13, which would allow them to keep that safer airflow. Individuals may smell smoke in the air, but all the particles that are harmful have been taken out of the air by MERV 13, and as well as COVID particles have been removed by the MERV 13. So the ventilation system is really very effective nowadays. That's kind of the update, Karina. I think if people have questions specific, that might be another way to use the time wisely.
Great. And what I'll do, that echo. Let's see if this works. Yes, much better. So I'm going to mute you while I'm speaking, and I think that helps. So what I'll do is I'll ask a couple more questions that came in through our messaging system, and then we'll go to those that showed up today. And I hope that those that were able. Also, I think one of them mentioned that they were bummed that it was during the time that they pick up their child from school. But yes, we obviously have it on Facebook so they can watch it later. So I'll make sure that their question gets in as well. So I'm going to ask their questions. I'll just ask, there's a couple, and then you can answer them. And then I'll go to the audience comments for today. So let's see. The first question, my child attends Harker Private School at Santa Clara County. We are told no vaccine mandates, also no quarantine required if our kid is exposed to someone with COVID with mask on. How is these guidelines will prevent our kids? Can Santa Clara County please made it mandatory to vaccine for all schools? We have to send our kids to school to unvaccinated teachers and staff. So that's one of the questions. And then I'm going to read the other questions. You did answer the one regarding the air. Thank you so much. The other question was, my child attends. Oh, that was the same question. Okay, hello. Currently, the county advises school districts to close doors and windows on days. Well, I think it's also similar regarding the air, which you talked about. So maybe just that one regarding the private school, and then there was one other. I'll go ahead and mute myself and unmute you so you can answer that one, and then we'll go to the next one.
Great, thank you. I would encourage that individual to check back in with their individual school. All schools in the state of California, private, public, and charter, are expected to have employees vaccinated or have routine weekly testing. So that's an expectation from the governor and California Department of Public Health, is that all school employees, regardless if they work directly with kids or in school offices or in facilities or in the bus system, they're all expected to be vaccinated or have routine testing to ensure that they are COVID-free in the school environments. So that would apply to the school that you mentioned. Additionally, they need to respond to vaccinated and unvaccinated close contacts to COVID-19. So if a vaccinated student at the school is exposed, they need to go ahead and follow the protocols. And if there's an unvaccinated student, they have to follow the protocols for being a close contact. Close contact is defined as being close to someone that has COVID-19 within 6 feet of proximity, so 0 to 6 feet space, for a duration of accumulation of 15 minutes. So it could be 1 minute here, and then another hour could be 5 minutes, and then another hour later it could be 5 minutes, and then even another hour or 10 hours later, 4 more minutes would be a total of 15 cumulative minutes in a 24-hour period of time is considered a close contact, regardless if you're wearing a mask and regardless if you're vaccinated or unvaccinated. So all schools need to respond to vaccinated, unvaccinated, close contacts in the school setting. What's different is if the protocols on what their quarantine would look like is if they're vaccinated and unvaccinated. That's the difference. So I'd recommend if people want more information to reference CDPH's guidelines around the quarantines, around modified and traditional regular quarantining information.
Thank you, David. And this next question, you may have to repeat part of what you just mentioned, but I just want to make sure that the person who sent in the question can hear the answer specific to their question. And so this one says, my main question involves a protocol if a child has a COVID symptom, most of which overlap the common cold. According to the guidelines, if he has even one symptom, such as cough, he must quarantine for 10 days since symptom onset and on at least 24 hours without fever and other symptoms have improved, with no regard to negative COVID tests. This seems absolutely ridiculous, and almost every child will be out of school for multiple 10-day periods throughout the year. How is this sustainable for the child's education? When will we see guidelines revised? Additionally, when will the county provide a dashboard with COVID information for children? A few districts are doing this on their own, but not all, including San Jose Unified. If the individual districts won't do it, I would expect the county to provide that information in aggregate. So let me unmute you 1 second. All right.
That was a lot of information. Great question. So let me break it down. If a child or individual has symptoms of COVID-19, which there's a whole list put out by the CDC and California Department of Public Health. We have it on our website also. Vomiting, headache, nausea, body aches, sweats, chills, coughing, sneezy, runny nose. Let me take out the runny nose. All the ones I just mentioned are very common symptoms of COVID-19, and if you have those symptoms, you need to be tested immediately. A runny nose by itself sometimes is not a symptom of COVID-19. It's hard to discern for the little kids because sometimes they may not realize they are fatigued or tired and have a runny nose, but those would be two symptoms together. Older children, it's easier to be like, oh, I just have a slight runny nose. It's probably nothing. If there's no other symptoms associated to a runny nose, you would want to monitor it to make sure there's no additional symptoms. But runny nose onto itself here in our localized county, we don't necessarily identify that as a symptom of COVID by itself. But runny nose, headache, runny nose, cough, runny nose, fatigue, that type of symptom would be an identified COVID-19 concern, and you'd want to test immediately. So you'd want to isolate and test immediately. If the test results come back negative, then it might be a typical flu, it might be just a cold, it might be something else. At that point, when your symptoms subside, you'd be able to continue on to your regular activity, as long as you had an effective test and make sure that the test was accurate. If it's accurate, then at that point, it's just probably a common cold or something else. You could continue on with your daily activities. You don't need to quarantine for 10 days because at this point, you'd be testing to see if you're positive or not. Now, if you're a close contact, that's when you have to quarantine for 10 days because you've been exposed for a period of time. It's a likelihood that you've been exposed at a greater rate. So that's different. But if someone just has symptoms, you want to isolate and test immediately. Results come back. If you're negative, good news. You want to wait till your symptoms subside, and then you can continue on your normal activities. If it shows up positive, then you move into a 10-day isolation period. I hope that answers that part. The other question was around data and wanting to look at cases in Santa Clara County. Santa Clara County is case managing all the positive cases in our county. Individual school districts have the choice to post that information if they'd like to put it on their website. I believe the state has some of that information on a state level. Here in Santa Clara County, we're gathering the data and we can take your recommendation under advisement and I'll share with our data team. I'm not sure to what degree that information would be available through Santa Clara County, but many school districts are providing that in their own local areas.
Great. Thank you so much. Talk about multitasking here, facilitating and, trying to get the echoes down and things like that. But thank you so much for that answer. I'm going to go to the questions now from our community who showed up to our community forum. We first have Rob Avina. What I'll do is I'll highlight his question, and then after I've read it and you've seen it, I'll take it off so that you can help us answer it. So let's see. We have Rob Avina. Hello, as a parent of a 6-year-old Child and Independent Studies in the SCUSD, we have repeatedly told the district that we want all unvaccinated students to participate in pooled weekly testing while our kids are under 12 years old, 12 years of age, cannot be yet vaccinated. Why is testing not mandated for kids this age at as it is for older people in similar situations? If outdoor activities greatly reduce the likelihood of COVID-19 spread, doesn't indoor activity increase it enough that COVID-19 should be, I'm assuming, tested? Let me unmute you. All right.
Routine testing is a effective strategy to see if there's COVID-19 in your community. Before I answer more, I want to share a resource. Two pieces. One is the California Department of Public Health defined the criteria for this school year. Mandatory testing was not mandatory. It was guided recommendation and targeted recommendations for different conditions when there's a certain level of community spread in your local area. California Department of Public Health has also provided resources for school districts, private, public, and charter, to help them set up different testing strategies. And the majority of the schools in our county are working with the California Department of Public Health to set up testing in their school environments. Part of the challenge in reality is that we have a lot of schools in the state of California, and CDPH is working with as many as they can to set up testing. So it's currently underway. It's improving, and it's going to get better over time. Unfortunately, it's taking a lot longer than people would like.
David, do you have a website or something that I could put on while you
It's CDPH. It's there. I don't know if they have a testing page that would talk about that specifically, but it's been shared with all the schools in our county, and we've provided information repeatedly for them.
cdph.org?
The CDPH main website is cdph.ca.gov. And then from there, they can find out a lot of this information that I'm referencing. They have drop-down menus specifically for education, and guidance documents is what they'd want to be looking for. Thank you, Karina. So testing strategies our testing support is happening in schools. It's getting ramped up. It will improve over time, but unfortunately, there's a lot of demand. In your question specifically about pool testing, there's a few different types of testing. Pool testing is when you would take, let's say, a group of students in a classroom. They would do a quick swab test. They'd put it into one pool where you'd have all the students submit. It's a way to test a whole class quickly. If it comes out negative, it means everyone in that class was negative. They could do a rapid test for a pool sample and to ensure that you'd get that information quickly. If it comes back positive, that means at least one person in that pool test, in that classroom, let's say, has potential COVID-19. Then they would go back and routinely test the students in that pool. So for a large school that has, let's say, 30 classrooms of students, they could do pool testing quickly, find out that 29 classrooms had no COVID, but one had a positive test. Then they could drill down and test specifically once again for that group of students. So it is an effective way to move quickly through some testing. Some school districts are able to provide that. Again, we're building capacity. Some districts are providing additional daily or weekly screening with antigen testing. Some are doing PCR testing. Again, it's just a variation depending on which school and what they've put into place. And schools are using testing as a way to keep children in school when they've been exposed to a positive 19 case, and then they would be able to use modified quarantine.
Great, thank you so much. Our next question here, can we strengthen the notifications in schools, classes instead of close contacts only?
Not sure if I understand the question. Strengthen notifications. Well, when there's a positive case on campus, schools are expected to notify the individuals that are identified as close contact. So in a classroom, the individual students would be notified, the student, the parent. Schools have the choice of informing the larger population in the school that there was a positive case on campus. It's a recommendation, but it's not a mandate. The only mandate would be to identify the positive student and the close contacts that are close. A lot of schools also notify the larger community, but that's an individual local school district decision.
Thank you. And I do see here a couple of questions, a couple comments about what is a case rate for under 12, so for children under 12. I don't have that. I don't know if you have that, but I think it's great questions to ensure that we provide that information moving forward. As far as an update, I can request the accurate information for the days of our community forums. Um, all right, let's see. Thank you so much for your comments. I'm going through the questions. Um, okay, I'm gonna go through the questions, ensure that we answer the questions on here. Let's see. In the county K through 12 guidelines, does it say anywhere that at home COVID testing is not allowed to satisfy testing requirements? Asking because our school district is saying at home testing per county guidance, we do not accept at home test results when a negative test is required to return to school. And our employers have provided test kits for Q Health and BioIQ which are not allowed to use. I want to make sure they are applying the correct guide or the guideline. Let me unmute you. All right.
That's a great question. California Department of Public Health, the guidelines that we're following here in Santa Clara County, recommends that the in-home kits are not really relied on for the school modified quarantining and school screening. The reason being is it's there's potential for user error with the home kits. Sometimes the samples aren't collected accurately, or maybe not enough of the sample gets taken. There's a lot more user error and variables when taking a home kit sample. So schools have been encouraged by CDPH, and the recommendation is that they would use their own screening tool, a county screening tool, a healthcare screening tool, maybe a pharmacy that could provide it. Some schools will, if parents have home kits, could bring the home kit to the school, and then their trained school staff could observe them using the home kit. Some school districts are using that because then the school would be helping ensure that the facilitation was accurate, that the capturing was accurate. But that's not all schools, and again, that's just some schools are using that as another strategy to help. But CDPH really recommends a test center, county run program, or the school themselves to be doing the test to ensure the highest level of accuracy. The home kits are really good for your own home surveillance. Maybe if you go out in activities with your community outside of school events, that's helpful for your own screening.
Okay. So the next question we have from Tiffany Orozco Vierra, do the schools have to send an email every time there is a positive case at the school? San Jose Unified School District sends one out even if not close contact. We already have 4. Your child was in a close contact emails from our school.
Schools have to notify positive cases on campus and the close contacts. They're recommended to notify the school community when there is a positive case in their schools, but it's not mandatory that they notify. Each school district will make their decision if they choose to notify the entire community or just those that were in proximity to it.
Thank you. And we have Christine Jurado here. Is there a requirement for a more protective mask for unvaccinated school teacher staff? Are they allowed to take breaks, lunches indoors?
Mask requirements, I think we go back to the best knowledge that came out around masks is the medical mask, the basic mask, double masking, cloth mask with one of those surgical masks is one of the best. They say those together would be equal to 90 to an N95 mask. N95 is the most effective, but we're really saving those for first responders in hospitals, etc. But a surgical mask and a cloth mask together is almost equivalent to the N95 mask. Teachers are allowed to take their breaks. That's part of their contractual agreement. They can take their breaks indoors by themselves. They can eat indoors by themselves. If they're outside, they can move freely. They can eat with their groups, but they need to be outside. Most school districts are not are recommending to not have their break rooms open, so they would want to be taking their individual breaks by themselves to stay as healthy as possible. Outdoors the best. Get some fresh air. Um, yes, I hope that answers.
Thank you. Trying to figure out this muting and multitasking here. Okay, the next comment, next question we have. Where can I find the list of current Santa Clara County sites for testing and vaccine? Need to print it out to post it. Very good question, Katie, because we've repeated it. And if you're asking a question, we haven't done it enough. So I will make sure to post that down here. Please take note of it. You can find all the information in the various languages, not just of where you can get your vaccine and your test, but also updates. We also have a school section. So very good question. There it is. Please take note of it. And thank you for participating. All right, next question. Can school districts make the vaccine mandatory?
Let me get back to the last question real quickly, too. You can go to sccfreetest.org, and that has a listing of all the test sites that's updated regularly. So I would just bookmark that. You can look at it every day. It changes, so if you print a hard copy, by the time you print it, it may not be accurate. So I would just reference the test site location regularly. School districts by the state of California and CDPH are expected to have school employees vaccinated. I believe the date is the middle of September. They need to be vaccinated. If they choose not to be vaccinated, they need to be testing weekly, and that's the expectation. We have a high percentage of school employees vaccinated in Santa Clara County. We have one of the highest vaccination rates in the country as a whole county. So we're doing really, really well. It's a very small percentage of staff that may not be vaccinated. And I think that's challenging when we get to the immunocompromised individuals, and that needs to be an individual decision that they need to be making with their healthcare providers. But that's a very small percentage. And then in terms of students being mandatory, I think that's something that is being explored in the future, and I don't have any more information regarding that currently.
Thank you. Our next question. Considering increase on case numbers, is there a plan to modify the guidelines in Santa Clara County? I think as leaders, they're reviewing the information on a daily basis, reviewing the cases. And if they do, we will know that as soon as possible. You'll hear it through us on our dashboard and our pages. But as far as I know, right now, there is no current update to the guidelines. And then I don't know if you have anything to add to that, David?
I think you're spot on. Right now, we're aligned with the California Department of Public Health. Our county office or our county management team is reviewing data regularly and just following with alignment with CDC and CDPH. If anything changes for a more localized order, we'd be announcing that as soon as we know. But right now, we're working with California Department of Public Health, as well as our Bay Area counties. You've seen some of our shared correspondence with our local Bay Area, just to aligning and the same messaging out. We're all trying to keep kids safe in school because in-person instruction is so important for our children.
Thank you, David. Next question. Quarantine guidance is different for childcare preschool, even though children are still masked, as in elementary schools. Why the difference?
Great question. We're still waiting for new updates from CDPH for childcare settings, as well as athletics, as well as for band and performing arts. That information we're hoping to come out soon. The quarantine difference for childcare and TK through 12th grade is different for a few reasons. One, TK through 12th grade, we have students that are vaccinated, so there's going to be some different nuances for the vaccinated students, as well as the older kids that are TK, that are 5 to the 18-year-olds, are much more successful wearing a mask consistently. So they are much able to help with their own mitigation process and practices. And the the preschool children, 2 to 5, 2 to 4.5, it's much harder for those individual little ones to keep their masks on. So CDPH has separate guidelines specifically for those developmental stages. And the preschool children, the little ones up to age 4, it's a longer quarantine. Well, excuse me, not a longer, but the 10-day quarantine period specific, and they're not eligible for a modified quarantine because just again the masking on the little ones is harder to really regulate and keep track of.
Thank you. Next question. Is the county looking at options for students to get tested on a more convenient and consistent basis? On-site testing to designate student COVID test centers within each school district, etc.
Great question. Again, school districts are all working hard to get their testing set up. The county's supporting that. We've increased our testing locations around the county and ramped up our locations for Santa Clara County in general, and that is all found on the scfreetest.org website. There's 32 different school districts. We have a whole bunch of charter schools, and we have a lot of private schools. All those schools are able to work directly with the California Department of Public Health to set up their own testing, and we're helping facilitate that. It is taking a little bit of time because it's just a lot of individual schools around the state. And CDPH is, they're limited resources that just takes a while to get everything set up. So if
Thank
you're,
you.
oh,
Sorry about that.
that's okay. I would check with your local school to see what regular testing they may or may not have. And if they don't have it, then I would encourage you to connect with the local county testing and or healthcare providers.
Thank you. Next question. Is there any guidance for quarantine for domestic and international travel, both students and staff?
CDPH has an updated travel guidance. It's on the website through CDPH, the website that Karina put up earlier. If you go there and you look for the latest updates and you scroll down, there's an area for travel guidance that's for vaccinated and also for unvaccinated individuals, both domestic and international. Yes.
Thank you. All right. Next question. I don't want to miss any. Lunchtime is worrying me. The kids sit very close in elementary school, and even though they are outside, it seems like a long time to be unmasked in close proximity. Can we space them out more? Can't we space them out?
Schools can space students out to the degree practicable. Yes, we are encouraging that people use physical distancing and outdoors to the greatest extent possible. I think you're right. The eating is probably the greatest risk when people are in close proximity. We're generating more aerosol, we're breathing closer to one another, and when we're eating. So spreading out is always the best that we can do, and we're encouraging schools to do that. Some schools have more space than others. So again, I would make your recommendations to your local school district and see how they're addressing their lunchtime activities. And you can advocate for outdoor eating, more space in eating, and see what you can do to encourage districts. I know districts are working hard regularly with us. We meet with our school districts regularly to go over the guidance, to be problem solvers, and to provide some support on helping them develop their best protocols. So districts are working really hard to improve, and good ideas are always helpful. So I would encourage you to go back to your home school district and ask and provide some suggestions. Can we spread them out? I'm sure they're thinking about that also, but it's just always good to communicate with your local school district.
Thank you so much. Next question. Candice Avina, can you make it mandatory for schools to report the number of students who opt into COVID testing by classroom?
That I don't really, we don't have that mandatory piece. That would have to come from the California Department of Public Health. And that would be, at this point, we'd be following their guidelines. So if they make those guidelines part of it, then we're currently following that at the county level. Then we'd be following it here locally if that's what CDPH decided to do.
Thank you. Next question. When can we expect a COVID dashboard for pediatric cases by county or zip code? Right now, it's all under 18 as one line item in the main COVID dashboard for the county.
That information, I can rely your question over to our data team. I think the data team would be probably the most appropriate to take that under advisement. I'm not sure, but I will share that with our data team.
Okay, next question. We have, my child's school has canceled activities as a result of data provided by the Santa Clara County of Health. What data is this and where can it be viewed by the public?
I'm not sure what data she's referencing. We review the data slides that Karina was showing you at the beginning of the presentation. They're all on the public website. It's our data website. It shows such as vaccination, case rate, age different sectors, hospitalization, ICU beds. It has all the data that's available that we're tracking. We share that with our local school districts on a regular basis. And I'm not sure what activities they would be canceling. I think there's certain things that are challenging with the current guidelines, and we're still waiting for additional guidelines from CDPH specifically for athletics, also for drama, band, choir, because of the singing and the generating the aerosol. So we're waiting for more guidance from CDPH. Those might be activities that the school district may have decided to maybe postpone until the guidance comes out. But again, I don't know specifically to the question she's asking. But I would encourage people to take a look at the guidelines that are on the CDPH's website and look at our data and, kind of get some more information. There's a lot, but it's also it's good for, families to take a look.
Thank you, David. Next question. Let's see. Since we know by now COVID will always be circulating in our community despite the level of vaccination we achieve, will masks always be a Santa Clara County requirement for kids in our schools? What is a threshold are we what is a threshold? Are we striving for? What data studies is the county using to affirm masks work?
This is an ever evolving process, this pandemic, and our local public health doctors are working with California Department of Public Health doctors to make those specific recommendations based on their training and the scientific data. I'm not sure of what metrics would signal a change in the mask order. That is something that we'd have to rely on the medical community and the scientists to help us with that information. I think you're right that COVID's going to be here for a while, and we're going to have to continue to learn how to live with COVID and to improve our practices to be safe. And I think we're all working towards getting back to a really healthy, robust community where we can feel really good in community and not be afraid of COVID-19.
Thank you, David. Oh, sorry.
Just one more thought, just the Swiss cheese approach. The mask is one of the most effective ways to keep protected. Washing your hands and doing all the other mitigation and routine testing. Those are things that we're using now and they're effective, and that should help us continue to get through this pandemic safely.
Thank you. We have 5 minutes and I'm trying to get through all the questions. So I apologize for muting you there. Can they make the vaccines mandatory?
We've answered that. School employees are expected to be vaccinated and or show proof of that they do routine testing weekly. So that's from the state level.
Thank you. Since the pandemic, even with my form of autism, I have been harassed and scrutinized that I cannot, as opposed to refuse to wear a mask in compliance with ADA. How will the United States, counties, and U.S. accommodate to teachers, staff, and students with special needs who cannot wear face masks, such as those with autism and or Down syndrome, asthma, or hearing impaired?
That's a really important question. Thank you for asking it. Each individual, for employees and staff members, we'd be working with human resources and using the interactive medical process to work with them around their medical needs and their individual needs around masking and other alternatives. In terms of the individuals with students, we use the IEP process, the individual educational plan process, and or working with students individually to see what the medical community is informing us as to their individual conditions. So it's very individualized, and that's how we approach it in schools and what we can provide safety, other layers of mitigation. If they're unable to wear the mask, there's other variety of mitigation strategies that are available that are very individualized. So if you're an individual that would have the need for that, I would encourage you to talk with your doctor and explore what other options you may have, and then share that information specifically with the school so then we could work with you specifically to help you continue access in school and be safe while keeping others safe as well.
Thank you. And I think I would just reiterate, I know in regards to medical letters, ensuring um, that you're able to submit those, right? I mean, we all have special or specific needs, and ensuring that we take care of the staff is important. I know in the county we have something similar where we get to submit our letter and our employer gets to honor that. Okay, we have Renuka. Can my child attend school immediately after a negative COVID test after she missed school due to a fever or other symptoms?
Yeah, if your student or your child is having symptoms and you get tested, the school may expect you to do a test at a test center, such as a county-run test center, your healthcare provider, or one of the pharmacies, or their own test center at the school. If that test comes back negative and it's a PCR test or an antigen test, then the school at that point would say, okay, then we hope your son or daughter feels better. You'd want to wait till the symptoms subsided. If there is a fever associated, that they'd wait at least 24 hours without a fever, and that they hadn't used medication to lower the fever. At that point, if they have a negative test, the student would be allowed to come back to school, because it would not be COVID. It would be a different virus, a different flu, or a cold, or some other condition.
Okay. Can schools share that what percentage of school employees are vaccinated?
Individual school districts can make that decision. I believe that when we surveyed schools earlier on in the pandemic around the county, we had 95% of the respondents confirm that they were vaccinated. So again, we have a very high concentrated percentage of vaccinated employees in our schools.
Okay. And there's only like two or three questions left. So just time wise, I'm gonna just go through those and there. Are there simplified COVID related educational materials for different age groups and languages? We assume people truly understand, but a lot still don't.
A great question. We have a lot of information translated in 5 dominant languages in our county. The letters we have for school districts are translated in those 5 letters, and there's resources for parents that are also translated. Those are on on our educational page. Karina, maybe you could put that in the chat. It would be our SEC Gov page, and then the schools resource page. There's a section for parents that have some of this information translated in 5 languages: English, Spanish, Vietnamese, Tagalog, Mandarin, I believe, and that information should be available.
David, do you know by any chance it's SEC? Is it just SEC? If you can just repeat it so that I can put it up.
So let me get right to it. So it'd be SCC. It would be covid19.scgov.org/school-guidance.
SEC. Sorry.
That's good. Yeah,
COVID-19.org.
slash school hyphen guidance.
SECCOVID19.org
Yep.
/schools. Okay. I'm going to add it.
Great. And this is a great page for families to go to. This has the table of contents. It has the information around different areas of school and related programming, the guidance, as well as toolkit. If you go to the toolkit, this information has a lot of this in the multiple languages that gives parents more information as well as a nice FAQ series of frequently asked questions.
Great. So you see it on the screen, and also Rob Avina put it in our comments. Thank you so much. You can always go back there and highlight and copy and share. Let's see. Let's go to, will children eat indoors unmasked and cold and rainy weather?
Each individual school will have their own food plans for eating and lunchtime activities. So I'd encourage you to check with your local schools. Depending on your school and what their available resources, it may look different around the county.
Okay, last question of the day. Teachers speaking to unvaccinated children could wear N95 masks for maximum protection. Is that being considered?
Teachers can talk with their school districts and request N95. Unvaccinated teachers have that ability through CalOSHA. So I think some teachers have that choice if they would like it. Again, double masking, a surgical mask and a cloth mask together is they equate it to be as effective as an N95 mask. It's also doesn't have to be fitted. The challenge with an N95 mask is you need to be fitted to make sure it accurately fits your face, and that also that if you have a fluctuation in your body in terms of weight gain or weight loss could change the fit, and so you need to get it fitted regularly. That could be a challenge, but the double masking with a surgical mask and a cloth mask is very, very effective, and I would just encourage folks to use that method.
Well, thank you so much, David. We went through all the questions that I mentioned we would go. We went over a couple minutes. Thank you all for staying with us. Please stay tuned. We will have these community forums every 2 weeks. Those of you who have joined us, in the past year or so, know that we're here every 2 weeks. The next one will happen in 2 weeks. It will be on vaccines updates. We'll have a doctor here who will be here also answering any questions you might have regarding the vaccines and COVID. And please let us know in the comments if there's any particular topic that you want us to ensure that we discuss related to COVID vaccines. If you want to keep talking about schools, let us know. We want to make sure that we are listening to our community and we're responding to your needs. Again, thank you, David, for joining us and for being here. For those of you who are Spanish speaking or know anybody that is Spanish speaking, we will have one at 4 o'clock in our Spanish Facebook. And make sure that you like that page as well and share the resources with the community. Thank you so much and have a great rest of your afternoon. Thank you, David.